Hello everyone, welcome back. This is the beginning of the GU module. And just a real quick note overview for the GU module. This is going to be a lot of overview, a lot of drugs, a lot of medications that we've already seen in other modules. So typically students do better with this module, and it is a lighter module, at least for pharmacology, or as far as pharmacology is concerned. It's not as heavy, not as intensive. So it's kind of a nice little break, kind of matches up with spring break, a little more chill. Still need to study though for it. There's still, things that I've said before important. Please still pay attention to. I just want to give you a heads up that this is a lighter module. Also, next up after this module, we are going to have a killer module. The musculoskeletal module for pharmacology is way heavy. It's tons of drugs, lots going on. So just a heads up on that too as well. So usually students will do better and it's a lighter GU module, but then they sort of struggle with the MSK module, the musculoskeletal module, because it is a lot heavier, a lot more intense, a lot more drugs going on. So just a heads up for that. The other thing too is it's always the last module this semester. So I definitely get that, like, end of the year, end of the semester, everyone's kind of slowing down. I think that's also part of why musculoskeletal usually kind of, ends up hurting some students. But anyways, just want to give everyone a heads up on that. That's just what happened this last couple years. Usually people do better on diuretic or the GU module than the MSK module, but just please FYI heads up that it is going to be, a lot more drugs in the next module than in the GU module. All right, so having said that, let's just jump right into it. As you guys could tell from the title, we're going to be talking about diuretics. And so basically, what does diuretics do? They cause diuresis, what is diuresis? It is water excretion. So these are drugs that will make you urinate, right? And so they will help you or help a person lose water, which can sometimes be beneficial, sometimes not. It's just going to kind of depend on the patient and what all is going on with them. And some other adverse effects too related to the diuresis, which we'll get into specifically. The electrolytes. So definitely throughout this presentation, please pay attention to the electrolyte abnormalities that some of these medications can cause, because the guaranteed test questions are going to be coming from those. So every year we do test questions on it. Same's true for this year. Role of the kidney, just a little bit of background. This is FYI for my exam, maybe some review from pathophysiology, maybe review from anatomy and physiology. But this is just, make sure everyone's on the same page. We all have a definition of what the kidneys are doing, and then what the glomerular filtration is all about. So just go ahead and read through this. But again, you can put FYI on these couple slides as far as test questions for my exam. Same thing here, normal GFR, which is a glomerular filtration rate. Again, just FYI for my exam, but it could be important and maybe tested in your other courses. So pay attention to those. This one again too, just so you know that there are let me see this slight little typo there fixed on the slides, but just know that definitely I've said from the beginning, since summer for success, what is Academy for Success, the summer presentation I gave, that definitely from pharmacology perspective we're concerned about the kidneys and the liver. So you notice here that there are different medications that are definitely excreted through the kidneys and have effects on the kidneys. And then they can have, sometimes desirable effects and some undesirable effects. So please put a note here, probenecid does block anion transport in the kidneys. Please note that. I've had some students that, I think as I said FYI on these other slides, they don't really pay attention to this slide. So please study this slide and know the details here. And just so you guys know, we have not studied probenecid yet, but it is a gout medication. So we'll be talking about that in the musculoskeletal module, the next module coming up. So just please note that. But yeah, please go ahead and pay attention to this slide. Here we have anatomy of the nephron. Again, FYI for my course, probably get tested on this in your anatomy course, I'm assuming. And it really where it comes into play and where this slide is maybe more important than this slide. This one I would pay attention to, especially when it comes to mechanism of action. You'll notice down here we have the diuretics listed, and then we have these, these numbers that correspond to where they work. So, for example, loop agents, for example, furosemide, the loop diuretics, which we'll be talking about. Number 3, this is where they're acting, so in the loop of Henle. So, I'm not going to say that you necessarily have to, memorize this image, but it definitely will help I think it helps. It helps me at least study for mechanism of action. And you'll see some of this repeated because definitely for testing purposes, I want you guys to know where these medications are working and specifically, you know, which ones are loop diuretics, which ones are carbonic anhydrase inhibitors, which we don't have that here, but it's just number one is one of those. So anyway, so here is the overview. As always, please pay attention to the categorization and how these things are organized. First off, we have the carbonic anhydrase inhibitors. So these are nice for studying in the sense that you can use, this is also the mechanism of action. So what do these medications do? They are carbonic anhydrase inhibitors. And then how are they categorized? They're categorized by their mechanism of action. So that hopefully will help you guys when you are studying. And I'm going to have more about mechanism of action here coming up and more detailed, but definitely take home point and make sure you know that these at least are carbonic anhydrase inhibitors for studying purposes. We have a list here. We will be seeing these medications being covered again in the ENT module because some of these medications can help with treat glaucoma. So in the list here, they all kind of end in the amide, so that maybe helps when you're studying them. They all kind of sound similar. This is showing where they work in the proximal renal tubules. The abbreviated is a PRT. Like I said, a lot going on here. Go ahead and read through this. I don't necessarily expect you to memorize each step. For my exam, that would be more for, you know, biochem exam. I think if I was writing a biochem exam, I don't know what world, I'm just sorry, I don't know what world I would be writing a biochem exam. But if I was, I would test you guys on the specific steps. But for testing purposes, I mean, definitely go and read through this. And I encourage students, because sometimes it helps students. I always have students that want more information, more detail. And then I also have students that want less information or less detail. No, and that they just, you know, want kind of the take-home point. So take-home point for mechanism of action, they are carbonic anhydrase inhibitors, which I abbreviated here as CA. It's not California inhibitors. But yeah, so carbonic anhydrase inhibitors, and that's also good for their categorization. So notice more here, more detail as far as what they're doing. This one I would pay attention to a little bit more because of the, like I mentioned, the electrolyte disturbances. Please pay attention to all of those. And the reason I'm saying pay attention to them is not just because it's, I mean, there's definitely going to be exam questions on it, but the reason I'm saying pay attention to is because students in the past have struggled with the electrolyte disturbances. And so definitely try to keep things straight when things cause metabolic acidosis versus metabolic alkalosis. When do things cause hypokalemia? When do things cause hyperkalemia? So those are things that I definitely want you to be studying and focusing on. And that's why I keep saying electrolyte disturbances. But yeah, so this may be helpful and beneficial when you're studying the carbonic anhydrase inhibitors. Mechanism of action, again, we're kind of beating a dead horse, as they say. I think that's the saying. Yes, that's the saying. Gotta look that up. But yeah, so we're kind of repeating ourselves here. But basically, there is a reversible inhibition of the carbonic anhydrase. So that's why they are carbonic anhydrase inhibitors. But what does that do? And like I said, please pay attention to this. It reduces hydrogen ion secretion at the renal tubule and an increase in renal excretion of sodium, potassium, bicarbonate, and water. So those are all things, again, that affect the electrolytes. So if it increases the excretion of sodium, what would you potentially predict? That you may have problems with hyponatremia, right? So I want you guys to start being able to kind of make those connections, kind of make those conclusions. And again, for my exam and for the board exam, the PA board exam, you will be seeing those types of questions. This second bullet point here is why they are related, or I'm sorry, why they work for glaucoma, which we'll be talking about more in detail in the ENT module, but just know that that is part of it. So it's decrease the production of the aqueous humor. So anyways, that's what it does. Uses, mentioned glaucoma here. Please read through these uses, look at all of them. I did list these all here as on purpose. Specifically here too, I'm going to highlight acute mountain sickness, which is altitude sickness. It's basically where you have to, where a person goes, an increased elevation. So for example, my wife's from Nepal. And so when people visit Nepal, they may not normally live at such a high altitude, and or when they do some hiking or trekking or whatever, they may suffer from acute mountain sickness or, altitude changes. Altitude illness is another name for it. But anyways, the reason I'm highlighting that is because both my wife and I had on our board exams, we had acetyl. There was some hiker in Colorado or wherever, or some mountain, I don't know, Kilimanjaro, I don't know, whatever the mountain that they pick, the test writer picks. We kind of joke that there's always this mountaineer, I guess is what they're called, right? Mountaineers that have this issue and they have to prescribe acetylsolamide. So, and the reason I'm mentioning that is because, that is a potential board question, something potentially to see on my exam. But just the point is here to definitely look at all of these different things. You'll notice too, it also helps with metabolic alkalosis. So please look at all of the uses here. I also have the uses for the carbonic anhydrase inhibitors broken down. So not all ones are used for the same thing. So you'll notice here, none of these medications here can be used for the altitude sickness, which I just was talking about a little bit. And then sometimes too, like some of these are made in eye drops, so they're more beneficial. They're better for glaucoma because it's better administration to the eye. Definitely please go through and look through these. And I know too, I've had some feedback that, I kind of mix up my modules in the sense that, I'm talking about the ENT module here, but please just bear with me. And there is a method to my madness. I'm trying to get to you guys to not only learn the modules, but able to connect the dots between the modules. So that's why there's some ENT stuff here. And so for studying purposes, yes, please study it. Please look at it now. Even if there isn't a specific glaucoma exam question on this module, you'll be that much stronger and that much more prepared when you take the ENT module. And there is there is a glaucoma question in that module. So I encourage students to look at it. And like I said, I encourage students to always make connections across modules. And I mean, for the acetazolamide is a great example. I mean, we don't necessarily have a module that specifically talks about acute mountain sickness, but then you may have a board question with it or a test question from that. So it's kind of like, well, where does it fit and where do you put it? And anyway, I'll get off my soapbox about that, but so please study all those. Contraindications, the hepatic cirrhosis is going to be one. Definitely put a star by that. These medications may lead to hepatic encephalopathy. So what does that mean? Definitely with exam questions, board questions, and with your patient population in the future, be mindful of the liver. And, if you have to be worried about the liver, then these medications you may be a little bit more concerned with. Next up, we have a very popular class of medications. These are the loop diuretics, also known as high ceiling diuretics. It just basically means, all right, caught the cough, so I didn't cough in you guys' ears. Basically came back too quick, didn't let that cough pass. That's what I get. I'm trying to do this quickly, that's what happens. High ceiling, just another way of saying just that they have profound diuresis. So you'll notice these are the ones that you can basically, they're more potent is another way to think of it. We have the list here. Please make sure you know those. Mechanism of action here. And again, in more detail, you won't necessarily have to be able to regurgitate and memorize these steps, but you will need to look at the take-home point as far as that they are working via the loop of Henle for mechanism of action, and they cause profound diuresis. So, and again, relative speaking to the thiazides, they also have a potential benefit on the preload to the heart, so that can be beneficial for certain patients. And this is another advantage of these is that you do not need to be concerned as much with renal impairment, excuse me, because these loop diuretics will still be effective. So anyways, and then read this last point as well, that they do also upregulate the cyclic oxygenase and activity. So basically, take home point, that means they increase renal blood flow. It's gonna be advantageous. Ethacrynic acid, the first one, is a little bit different. Definitely, when you're studying it, categorize it as a loop diuretic, but then think of it, maybe put a asterisk on it or something, or put a little side note, in that it's really used, so it's a loop diuretic, but it's really used for people who have a true sulfa allergy or the sulfonamide allergy, because unlike the thiazides and furosemides, those chemically have the sulfonamide group in them. So a person with a sulfa allergy may not safely be able to take a furosemide or thiazide diuretic, but they can take the ethacrynic acid. So it's always, when you're studying, going through board reviews, board exams, etc., you'll notice this is the patient that, it'll be a case presentation. They'll have a little blurb about how they have an allergy to sulfa antibiotics, right? And then they'll have one of the answer choices is furosemide. And if you pick that, it'd be incorrect because of the sulfa allergy. So this is an instance where the ethacrynic acid would be preferred. Other than that, it's not as popular. So usually the furosemide is a more popular loop diuretic and more commonly used. You'll probably come across that more so. And just FYI too, the furosemide brand name is Lasix. So anyways, just an FYI on that. But this one is kind of niche in the sense that if a person has an sulfonamide allergy, so please make a note of that. Adverse effects, the ototoxicity is one of those rare but serious ones. It can cause permanent hearing loss. Furosemide, like I said, very popular generic Lasix. Here is the mechanism of action. Please read through that. You notice it has an effect. Hint, hint, no, but definitely put a star. It has an effect on the electrolytes, which we'll see here with the adverse effects, but basically works via the loop of Henle. So make sure you know that. Also related to that, have already seen on some of my exams, I will refer to these medications on my exams sometimes only by their mechanism of action. So I may say that the patient is taking a medication that works via, that inhibits the sodium chloride in the ascending loop of Henle. And then, what are some adverse effects you can expect, etc. So I may not list the drug explicitly. So again, start studying your drugs and make sure you're being able to go back and forth with your, mechanism of action, categorization, and drug names. Uses here, please read through all of these that I have listed. You'll remember from the cardiology module, they can be used for hypertension, but it's not recommended for initial treatment. So that's just please make sure you remember that from previous. And then edema, and then hypercalcemia, ascites due to cirrhosis is an off-label use. Hypercalcemia. This is where you'll see some study textbooks that say loops lose calcium as kind of a study guide there. But and this is one of the instances where a loop diuretic will be given with IV saline because of its profound diuresis and stuff. But actually, so it helps lose the calcium or excrete the calcium, but then you also don't want to dry a person out. Adverse effects, definitely put a star here. Want you guys to study this. Guaranteed exam questions will be coming, based off this. Like I said, electrolyte abnormalities, big theme here. Excuse me, during this module. So please look, is it causing, is it increasing or decreasing potassium, increasing or decreasing sodium? The hypocalcemia we already talked about. It causes metabolic alkalosis. Please look at that. Hyperuricemia. So this may be an issue with a person with gout. The hypomagnesemia, and then hyperglycemia. This can be an issue too with your type 2 diabetics or anyone else that you're concerned about having an increased blood glucose. So not only study this and look at these adverse effects and make sure you know them for the exam, but also think about the implications. So again, if there's a type 2 diabetic who's on this long term, or how long are they on it? Are we gonna have to make adjustments to their insulin, adjustments to their other medications, etc.? Definitely something to be mindful. If this medication is used, acutely, short-term, inpatient setting, so in the hospital, they're given a little bit of loop diuretic and they have high blood glucose. It's something that you'll want to monitor. They'll probably be on sliding scale insulin, so it won't be that big of a deal. But then outpatient, maybe it is a bigger deal. You're sending them home with this medication and they're supposed to take it for a month or whatever. Be mindful about making adjustments to their other, diabetes medications, for example. Box warning, as always, put a star by here, so make sure you guys study this. It is very potent diuretic. Like I said, it's high ceiling diuretic, and so you can actually, it can be detrimental or be damaging to a person, so please read through that. But because of the fluid electrolyte loss, and it's just basically, again, because it's such a potent diuretic. Also, too, I want you to note, sometimes I will highlight geriatric populations or pediatric populations. Just please note here that the loop diuretics are a high-risk medication for the geriatric patients. I believe I've shared with you before the Beers criteria. I've talked about that. So those are those medications that are potentially inappropriate or higher risk for your geriatric population. So definitely encourage you guys to get a Beers criteria. They have a pocket size, etc. If you're going to do any kind of geriatric rotation or you have any, geriatric patients. But definitely read through this and also put a star by this. Bumetanide and torsemide, so they're similar to furosemide, but they're more potent and have longer durations of action. So for studying purposes, you can definitely put all the same adverse effects and uses and stuff, etc. Just this little note here that they are a little bit different. Oh, and because of their longer duration of action and they are more potent, they are less used than furosemide. So really out of loop diuretics, the furosemide is going to be probably, I'm going to make a guess, that is going to be the biggest one you're going to see when you're out on your rotations, especially on your hospital rotations. Thiazide diuretics, again, a lot of this is repeating from the hypertension module. I'm sorry, for hypertension during the cardiovascular module, but just bear with me. So I think actually, and that's probably another reason too, I'm thinking out loud here, that's probably why students do better too, because a lot of it's review. And so it's nice to be able to kind of revisit some of these drugs and study them again. Mechanism of action, definitely read through that. Make sure you know that. It uses edema, but then please look at the note here and make sure you read through that as well. Other uses, hypertensions, like we talked about before. So a lot of this is a review. I'm not going to spend too much time with it, but, go ahead and read through it. You'll probably be, familiar with a lot of this uses because, like I said, we spent quite a bit of time on this in the cardiovascular module. So a lot of this is review for you guys. I'm not going to say FYI because I want you guys to still be studying it, still be thinking about these medications. And like I said, definitely on my exams, I will start overlapping. You'll see some more overlapping as far as you'll have kind of a cardiology light question or a question that you might have seen in the cardiology module will be coming back because it's related, because of its diuretic properties and adverse effects, etc. And a lot of your patients are, on the board questions, and then in real life, they will have, a group of medications that are come from a, variety of different modules. Off-label uses too, please go ahead and look at these. I don't know if we had mentioned these before in the cardiovascular module, so please go ahead and make sure you add these to your tables and to your study guides. Adverse effects, again, put a star by this. Definitely want you guys to keep this straight. Make sure you know what it's doing to the potassium, what it's doing to the sodium, causing metabolic alkalosis, right? So please look at all of these. You notice the hyperglycemia is a player again, like with the loop diuretics. So what are the implications of that? With your type 2 diabetic patients, etc. So yeah, please make sure you look at that. And like I said, part of the reason I keep emphasizing this is because students have historically gotten these things mixed up. And I know as a student, I was the same way. It's sometimes I would get hypo and hypernatremia mixed up. And so please try to keep those straight. I've gotten some people sharing me their charts. They're looking great. If that helps, and if not, just whatever helps, please keep doing it as far as, how to keep these adverse effects straight. Next up, we have the Thaizide-like drugs. Again, review here. These are maybe, like I said, more popular first-line drugs in other countries and in Europe in particular. Potassium-sparing diuretics. We have the aldosterone antagonist. So these, again, as a review, they usually will help prevent against the hypokalemia that you notice with the loop diuretics, and with the Thiazide diuretics, hypokalemia is a concern. So this may be a strategy when you're trying to spare your potassium. Mechanism of action here, competitive inhibition of the aldosterone receptor. Uses, please go through these and look at these. You'll notice some of these have some overlap with the endocrine module, so please still study them for this module. But yeah, I want you guys to put a star here and make sure you know all of these uses. Adverse effects as well, as always, make sure you know. And then it makes sense, but I've had people miss exam questions in the past, to note that this is one that can cause hyperkalemia. So we notice the other ones, thiazides, loops can cause hypokalemia, but this is one, and it makes sense in this. And I'm not going to say easy or straightforward because I know students hate when I say that, but they're potassium-sparing diuretics, and then so there's some logic behind the fact that they can cause they can cause hyperkalemia because they're preventing, they're causing or rather preventing hypokalemia, so the hyperkalemia is there. But please, please make sure you keep that straight. Like I said, for exam purposes, guaranteed, I'm going to have some test questions on that. So you can put a star by that if you want. Some more sodium-potassium ion exchange inhibitors, changing gears a little bit, the trimethylene and amiloride, amiloride. That's what happens when I don't pause when I need to cough. I just end up messing stuff up. Sorry, guys. All right. So please go ahead and you know, again, these are review, but please go ahead and keep studying these. Look at the mechanism of action here. Okay, I did a last minute quick edit, so I know it's going to look weird, but this is the slide I was on before. I'm kind of editing as I'm recording, which is so that you probably have an image of a slide that I changed because I didn't like the way it looked as I was recording. So sorry about that, but you guys will have the proper PDF with all updated stuff. So anyways, I changed the mechanism of action slide a little bit, and one sec. Okay, I just want to make sure it looks pretty. Make sure it looks nice for y'all. But I don't want to win all Southern accent on there, Southern Belle on y'all. But mechanism of action, I didn't like the other slide, so this is the updated one that I do think is more clear and concise. And then I added this, or rather, I tweaked this slide and put this here as kind of take-home points for it. So mechanism of action, it blocks epithelial sodium channels in the late distal convoluted tubule. So please refer back to that visual guide if you want to know where that is. And it inhibits sodium reabsorption from the lumen. So what does this do? And definitely please read through all of this and make sure you know, look at all the mechanisms of action, but the take-home points here: it increases sodium loss, increases potassium retention, decreases calcium excretion, and decreases magnesium loss, that's all said here as well. But those are, again, with the electrolyte disturbances, want to make sure you guys know of the implications and the take-home points there. So, anyways, yeah, and hopefully this slide, either that it reduces intracellular sodium, leading to potassium retention and decreased calcium, magnesium, and hydrogen excretion. It's saying the same thing as this, but anyway, so hopefully these two slides will help with studying purposes. Uses, not great as far as like first line for hypertension, but they can be used in adjunct to help prevent the hypokalemia, because like we said here, it increases potassium retention. And then it can also be used for lithium-induced nephrogenic diabetes insipidus. So this we'll talk about lithium in the psych module, but just know that one of the adverse effects of lithium is that it can cause the DI, or diabetes insipidus, the nephrogenic specifically, and that these may be beneficial. And specifically, amiloride. Adverse effects, again, I think there's some logic here, but hyperkalemia, definitely make sure you note that when you're studying these medications. And it also is a boxed warning, so definitely put a star by this. Want to make sure you guys think of this. And this is kind of a fatal adverse effect. So definitely please make sure you read through all of that and you are studying that with these medications. And I'm just showing here that it's with both the tramtrine and the amiloride. Osmotic diuretics, so yeah, and also put a star by that one. I think it goes without saying, but osmotic diuretics, we have the mannitol. Mechanism of action here, they basically work via osmosis, and that's why the name osmotic diuretics comes from. But basically the osmosis that it causes, or the osmotic gradient rather, causes osmosis, and then it causes fluid excretion. So it encourages diuresis, right? So that's kind of the take-home point of the mechanism of action, but definitely read through all of that. But yeah, basically osmotic gradient causes osmosis to cause for the fluid to be lost, or increased urinary output, in other words. And this is just kind of what I said again, but more simplified terms for mechanism of action there. So because of that, its uses, it can be used for edema, specifically cerebral edema. It can also promotion of diuresis in the prevention and or treatment of the oliguria or anuria associated with acute renal failure. These medications will be seen again in the mannitol again in glaucoma. I'm sorry, with being treated for glaucoma, so in the ENT module. We'll see this too with the toxicology. When we talk about toxicology, we're going to talk about that this summer, I believe, but it can help remove water-soluble toxins. And it's also used as an irrigant, so a GU irrigant, depending on the surgical procedure. Adverse effects, a lot going on here, so please make sure you study these, make sure you read through all of them. You'll notice it hits a lot of different things. So yeah, please make sure you study these. Just a quick note too, it kind of seems counterintuitive, but it can depend on the patient. It can cause both hypertension and hypotension. Has students in the past asked me about that. Yeah, you can double check on UpToDate or where other sources you want, but it's not a typo. And just so, yeah, kind of paradoxical. It's going to depend on the patient. I'm not going to trick you guys and make it, I'm going to make it clear cut if I have an exam question about the adverse effects of this drug. So don't stress too much about it. Like I said, hopefully you guys know me by now. I don't like to trick you or play the gotcha game or, try to trip you guys up. I'm trying to make things easier and more straightforward. I want, lifelong retention of these things that we're learning together. And so, yeah, I've had panic students, and I empathize with you guys. I get it. I don't ever, so email me, please. Even if I say, don't worry about it, and you still want to email me, you're like, you said, don't worry about it. But, I get that. I've been a stressed out, pharmacy student before, and I'd be like, I know you, and to the professor, I'd be like, email him like, hey, I know you said this in lecture, but pero like, no, I'm kidding. But yeah, that was me in pharmacy school. Pero like, are you sure? No, but yeah, so with the adverse effects for this medication, please study them all, make sure you know them all. But I will make it a clear-cut question, or as clear as I think. And again, as always, I'm getting a little sidetracked with the test question because I get I get questions about, what to study and everything. I also too sometimes make mistakes, and I accidentally make things confusing, or the wording's weird, or it goes against something I said. Always, please just reach out to me via email or whatever, or Skype after the exam, and we'll go through it together, and we'll try to see, where the confusion was. And the other thing is too, if I make a big mistake, I give points back. I will adjust the question. I'll throw out questions. So yeah, like I said earlier, we're learning this together. You guys are learning from me. I'm learning from you. I'm trying to become a better test writer, better lecturer, etc. So anyways, so yeah, I'll get off that side note. But yeah, look at these, study this stuff. Okay. Summary table here. So if you are looking at the book, please go ahead and cross out that there was a medication here that I decided we're not going to cover here. So just go ahead and cross that one out up there. But other than that, my slides will be updated as far as what has it crossed out. I just know some students will actually go to the book. Now we have some medications that affect water excretion. Again, some that we've seen before: vasopressin, desmopressin, ADH, and antagonists. So vasopressin is also known as ADH, which is antidiuretic hormone. And so you guys have seen this before in the endocrine module, I believe. So definitely go ahead and read through this, and make sure you are studying this as far as its uses, etc. So we have the desmopressin, which is a synthetic analog. So this is the medication, the antidiuretic hormone, ADH, aka vasopressin. So these basically, take home point, they result in a decreased urine volume and increased urine osmolality. So again, electrolyte implications there. And then they also have some effects on some of the clotting factors. So they that is related to its uses, where it's used for some of the bleeding disorder diseases that are out there. So this medication can be used for those as well. And so I have the uses all listed here. So you've seen this before, but please study this and keep these straight as far as which ones, as far as all of the uses and what all this medication can be used for. Adverse reactions, again, this is nothing new, but please look at this. I will note here, this does cause hyponatremia, and it's, almost 14% of the patients that take it. So it is a common and serious adverse effect, and something definitely be thinking about. Like I said, with a lot of these in this module, the electrolyte implications are going to be, we're going to be looking at and be seen on exams. Please read through that. Next up, we have the ADH antagonist. Lithium salts, like I said, we're going to be talking about these more in the psychiatric module, because these are mood stabilizer drugs. So this can be used for bipolar disorder. It's included here because it can be used for SIADH secretion, but it is last choice for treatment. So this isn't your first line. Basically, long story short, there's a lot of adverse effects. It can cause nephrotic diabetes insipidus, we talked about earlier. But anyway, so that's an issue with it, among other things. So it's a messy drug, and you have to monitor it, you have to take labs and stuff. And Yeah. So anyways, and we'll talk more about that later on, but just have it here. Just go and start looking at it, start studying it. But it will be a bigger player in the psych module. Then we have the demeclocycline. This is a antibiotic, and it's here because it has an off-label use for SIADH. So just note that, and please read through all that. Conivaptan is an IV synthetic vasopressin antagonist. So here's this mechanism of action that you can go through. Definitely read through all of that. But definitely look down here. It has a net fluid loss, increased urine output, decreased urine osmolality, and it subsequently helps restore normal serum sodium concentration. So kind of a tip of, with the mechanism of action, of what the uses are. So it can help treat hyponatremia. So to go ahead and just read through that. It also has an off-label use for heart failure. But again, with that hyponatremia. So take home point, kind of related to the mechanism of action there. Restoration of normal serum sodium concentrations, and then used for hyponatremia. So please keep that straight. Adverse effects can cause orthostatic hypotension, a fever. You'd have to be concerned with hypokalemia with it, and then headache. So headache, fever, common these are all just common adverse effects that you need to be concerned with. And again, please note that this one can cause hypokalemia, but it's beneficial to help treat hyponatremia. So again, had students in the past kind of get these things confused and mixed up. Please do your best to keep those straight. So I believe this is the last slide summary. As always, please look at these adverse effects contraindications for these medications. And I think that is it for this presentation. But if you have any questions, comments, feedback, please feel free to email me. Thank you guys for your time and attention. I appreciate it, and I will talk to you guys later.